You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to pmnrrecap.com to learn more.
Hi, all. Can you hear me?
Yes, loud and clear.
Perfect.
Awesome. And I'm Bassam. I'm one of the chief residents at Emory with GEO. So I'll go ahead and get started. Glad to have everyone here. Glad to be able to talk a little bit about the residency program. Next slide. All right, so just a little bit of an overview of what we're going to do today. We're going to talk about some of just the different rotation schedule and sites, some of the academic experiences and how the didactics works. We'll talk about where our residents go after residency and what kind of makes Emory and Atlanta unique. So just an overview of the rotations. Every rotation we have is about 2 months. The only thing that is 4 months is at Emory Rehab Hospital. We spend a total of 4 months in a medically complex floor, and that's 2 months, 4 months that are split up in 2-month blocks. But as a PGY2, you get early access to some outpatient rotations, including some sports medicine, some spine clinics, even to the extent of maybe doing some hands-on spine injections as early as PGY2. You get access to some SNF consults where whenever I am looking at jobs right now, that's a big pull. A lot of people are looking for physiatry jobs at different SNFs, and it could also be a good side gig. So it's a good thing to get access to pretty early. The rest of our PGY2 is spent in inpatient rehab. One of the big things that we have over here, we'll talk a little bit more about, is the Shepherd Center. PGY3, you get about 4 months of inpatient rehab, but the rest of it is a lot of general MSK, some consults over at Grady, which is our Trauma 1 center. And then as a PGY4 is exclusively outpatient with a mix of sports rotations, spine rotations, MSK, EMGs, and an elective that you've got a lot of room to tailor. So some of the sites that we have, one of them being the Shepherd Center, that is a dedicated rehab hospital to spinal cord injury and brain injury. Just a little interesting fact, it was started by one person in the family who actually had a spinal cord injury himself and wanted to create something in the Atlanta area for people with spinal cord injury. So there, some benefits, you have a pulmonary specialist who's also an intensivist there that's also on call with you. And the benefit of that is if there's something that you don't feel comfortable treating, then you could always get in touch with the pulmonologist and they could manage those things. The call is taken at home. So most of the times you don't have to go in, but you do answer calls at home, and it's every third day because there's 3 residents over there. And then again, some of the unique features of it is that you're working with some of the smartest people in the field. So some people that are triple board certified, including internal medicine, PM&R, and spinal cord injury, like Dr. Lynn, who's pictured there. And it is one of the top 10 rehab hospitals in the country. I think with the new U.S. World News and World Report, it came out as number 7 now. Another big site that we have is the Grady Hospital. That's the Trauma 1 center in the area. If you are familiar with Atlanta, you've definitely heard of Grady. It's where a lot of the traumatic injuries, gunshot wounds, really bad accidents go to, which is really neat, and seeing the broad spectrum of rehab patients, like from maybe the first or second day they get to an acute care hospital after traumatic injury, all the way through maybe day 50 at Shepherd. where they leave. So there's a huge spectrum of what you get to see over here. And then carrying that forward as a PGY4, you see how they progress in outpatient. So you get a good breadth of rehab in all the different stages of the rehab process. We also get access to spine procedures there, a lot of fluoro-guided procedures. We get access to Botox injections. And then one neat thing is getting EMG exposure with neurology. So not only are you working with some of the rehab doctors, you're working with some of the neurologists to kind of get exposure to some of the neuromuscular disorders that they might see in a neurology clinic, and getting EMG exposure with that. One place that you spend a lot of your PGY2 time is at the Emory Rehab Hospital. It's about a 45-bed hospital split up into 2 floors, and there's typically 4 residents on site over there. So one floor is a stroke service. The second floor is a lot of medically complex patients. And with the medically complex patients, it's always nice to have internal medicine on staff. So there is internal medicine and a nurse practitioner as part of the internal medicine group that's there 5 days a week to help out with any consults and things like that. You're going to get a good breadth of complex patients, which include a lot of transplant patients that include the liver team, the lung team, the cardiac team. And you get to know a lot of those transplant physicians, surgeons, coordinators really well, because they're very involved in their care. So a lot of learning opportunities from them, and things that, I haven't seen in med school or internship. And you really, expand your knowledge on everything while being at Emory. Another thing is, so call for Emory is in-house. The benefit of that is you get a post-call day after that. Typically it comes out as a PGY2 to about 5 times a month. As a PGY3, it's less than that, maybe like 4 times. And as a PGY4, you're going to be taking, the call that you take is usually as part of a moonlighting gig, and you'll get paid a little bit extra for that. Another really great experience that we have is CHOA, which is the Children's Hospital of Atlanta. That's where we do pediatric rehab. You get most of that time in your PGY3 year. The cool things about CHOA is that it's one of the few pediatric rehab hospitals in the country, and I think it's also one of the biggest. So you got a huge catchment area of, a lot of Tennessee ends up going to CHOA for rehab, all through Georgia and some of the other surrounding states around it. You get a lot of exposure to cerebral palsy, TBI, SCI there too, and a lot of congenital conditions that you don't see a lot of places. But now that technology and medicine's getting a lot better, what's happening is that these patients that had, or these kids that had these congenital issues, are needing more and more rehab. So you're getting to get a lot of exposure to those things. It's also one of the few robotic labs in the country, which uses a lot of technology in gait training, in how to do ADLs and things like that. So it's neat to, go up one floor and just check out how they do in the robotics labs. And then one of the newest buildings that we have is the Emory Musculoskeletal Institute. It is, I think, opening up maybe next week, and that's where you get to do a lot of hands-on spine procedures. So one of, I think, the perks of being at Emory is getting a lot of hands-on fluoro-guided procedures. A lot of people, by the time they leave, get over 100 procedures that they could log of actually doing, hands-on from the beginning of the procedure to the end of the procedure, with the guidance of the attending being in the room, but you're doing most of the needle work and things like that. It's also a main site where we get a lot of nerve conduction studies and EMGs. So in the Musculoskeletal Institute, it's part of the orthopedic department too. So a lot of orthopedic hand surgeons, neurosurgeons, even shoulder and like sports medicine doctors will send a lot of EMGs to the physiatry group over there.
Hi all. So I can take over now. I'm Gio. I'm the academic chief resident, interested in sports medicine and applying for sports medicine fellowship this year. One of the rotations is a PGY4 is the Emory Sports Medicine rotation, formerly with Dr. Mountner, and there's a tremendous amount of sports exposure and reputation, and in regards to working in the brand new Hawks facility. They also just opened up a Falcons facility that's brand new and Emory owned as well. Tremendous amount of exposure with diagnostic ultrasounds as well as ultrasound guided procedures. And because Dr. Mountner is in the field of the orthobiologics and just in general in sports medicine and in AMSSM, he caters to a lot of the research for kind of mentors a lot of the residents who are interested in going into sports medicine. So a little bit about the didactics and lectures. That's for the core curriculum. These lectures are sort of a 12-month repeat cycle. Every lecture is on Tuesdays and Thursdays, from 7 a.m. to 9 a.m. and then from Thursdays from 7 a.m. to 10 a.m. This is lecture protected time, and at this time it's sort of a hybrid didactics curriculum. We have we go through the Zoom lectures, but we have in-person workshops, and as well as some lectures are in person. For example, today we had sort of an in-person financial lecture, and then we have some further workshops throughout the year, and we'll talk about that a little bit later on in a couple of slides. But other things that are included for monthly is a journal club, and we have Rehab and Review with Dr. Burke, who is a department chair, and you have opportunities as a PGY2 to even have a contributing editor experience in the Rehab and Review. You have also Spine MSK Journal Club, which is run by our residency director, Dr. Monfred, with also a participation of the biostatistics faculty, Dr. Paul Weiss. It's pretty kind of very interactive with the residents. We kind of have just like 3 residents to kind of review these papers, and then the biostatistics person, as well as our program director, Dr. Monford, kind of rows them and kind of just like really focuses on the statistic portions and what the meat of the paper is. A little bit more, we're sort of a Canvas-based online platform for our residents. We kind of converted from like paper competency quizzes to now just online competency quizzes. We have everything in sort of the cloud-based SharePoint drive that we have shared with all the residents. And this is including kind of all the sort of textbooks, study guides, rotation information, board review materials. And we also, because the lectures that are recorded, we have recorded lecture library now that we're creating. A little bit more on the sort of the Emory specific conferences. We have an annual prosthetic and orthotic symposium in the spring, as well as also the annual Emory Sports Medicine Symposium that's also in the spring. These are all free for Emory residents to participate, as well as to submit research. And so an opportunity to submit research to these conferences. We have bi-monthly grand rounds and also specialty lectures. As I said, we had a financial education lecture this morning, but billing, coding, acupuncture, lifestyle medicine, and then also just resident requests. We kind of are very open to feedback, and we improve our lecture series annually, and kind of hear from the resident feedback. And us being from PGY2 to now PGY4, we kind of cater the lecture schedule to what we really would like in a academic curriculum. So for the hands-on workshop, very interactive. This is sort of at the end portion of last academic year. Typically we invite the sports fellows to help us with the workshops, and it's very hands-on. The sports fellows, we are catering to doing during the spring, where the sports fellows are very, very, very comfortable with the ultrasound. So they're very eager to teach us, and a lot of just like joint-based learning that we do. There's a lot of also teaching sessions throughout. There was a teaching session with during your sports medicine, formal sports medicine rotation with the sports faculty as well. And you get to kind of do models, as well as we used a pork shoulder at one point to kind of practice our injection techniques. And that's kind of just like very culture friendly in regards to the interactions with the sports orthopedics department and the Department of Physical Medicine and Rehabilitation. It's very positive. So a little bit about the hands-on workshops. In addition, we have EMG. I'm gonna just kind of play these videos. This is our wheelchair workshop that we're actually gonna have next week. And this is at Shepherd Center. That's one of our co-residents, Drupal, kind of acting himself. And we also had a gate-based lecture.
Same thing, right? Is that, you know.
And this is at the basement on the Emory Rehab. There's a gait lab. And then we also had virtual Botox. And again, also for the wheelchair stuff too. But we have spasticity lectures, spasticity workshops, migraine injection workshops. And then we also are going to, we incorporate a cadaver-based anatomy lab that we are planning to do for that are pre-dissected as well. And then also to kind of cater with the sports medicine lectures that we have in the year.
Five minutes.
So I can go on with Bassem here. Bassem, you're on mute.
Thank you. So since we only have about 5 more minutes, I'll just run through the rest of the slides. But some of the perks that we get, you'll get all this stuff through the interview process, but $1,500 a year for conferences, and you get 5 education days per year for that. Then you get a $900 educational fund that you could use over 3 years. And that includes like videos like PM&R Recap and things like that that you could use it on. Some of the places that our residents go, last year we had one person match SCI, a few match pain, one matched PEDS at UPMC, as well as VCU, the Amputee and MSK Fellowship. And then about 1 a year goes to general PM&R. Other things is, you know, we have a ton of sports coverage in the area. There's the Peachtree Road Race. We cover a lot of the high schools in the area, a lot of marathons, things like that. And then just some things that really makes Emory special is the people over here. They're very welcoming. You know, I know COVID put a wrench in a lot of things, but one of the things that happened our PGY 2 year and we're looking to bring back is annual meetings with the attendings inviting us to their house, having cookouts and things like that. Again, just relationships with attendings. We had a attending versus resident basketball game, golfing game. They got us in basketball, but we got them in golf. Some of the other things that we did was there was Christmas parties. The Shepherd Center, you know, it's super well known in Atlanta, which is cool because there are a lot of donations and stuff. But they were able to host a Christmas party over at the Georgia Aquarium, which is actually like one of the biggest aquariums in the US. So a lot of fun things to do. And just living in Atlanta, you know, if you drive up a few hours north, then you're in the mountains. If you drive a few hours south, you're at the beach. There's a ton of parks, a ton of trails to take, music festivals, good food, you name it. I think Atlanta's got a good diverse population. So just bringing it all back, why Emory, things that, you know, that we pride ourselves in is broad experience in all fields of PM&R, whether it's inpatient or outpatient, whether it's procedural or clinical. We got, I think, a pretty good, well-rounded exposure to that. Get access to level 1 trauma centers where you see acute TBIs, SCIs, and just living in Atlanta is pretty cool, having great faculty and the residents, and having 2 big med schools around here too. Makes it nice to interact with medical students as well as your co-residents and faculty. So take the email down, emerypm&rresidency@gmail.com. If you guys have any questions, feel free to reach out to us. You could DM us on Instagram, Twitter, and we'll answer those questions. And if we have any more time left, we could take questions.
Yeah, so we have 1 minute left. So for everyone in the audience, if you can drop your questions in the chat box. Is there anything that you guys want to mention?
You said, is there anything else we can mention?
Yeah.
I think there is one slide that didn't get showed, and it was the global health opportunities. This is actually an opportunity that I took upon, and as a PGY2, I went to Dominican Republic, and it was fantastic. It was amazing. Basically Emory has a PT department that has been going annually to Dominican Republic, and I was the first resident to participate in such a trip. And it's actually, COVID doing this, kind of putting that in halt. That's the plan that's going to be incorporated annually, trying to get a resident to participate in global health trips. And we also have trips to Ethiopia through through GME and Emory. But that's one thing that's unique for the program. Just wanted to put that plug in.
That's amazing. So I'm sorry, time's up. I think a few questions trickled in, so
Yeah.
feel free to answer in the chat box.
Yeah, no problem.
Yeah.
Thank you for having us.
Yeah.
Thank you. And I'll answer some of those questions in the chat.